Hello, in this video we're going to be going over some foot care. So something we're going to start with is massaging our feet with either a lacrosse ball or some sort of massage ball. It might look like this. It might have spikes if you're into that kind of stuff. Or if you're looking for something a little bit softer, your feet are really sensitive, a tennis ball works great too. Then the massage is going to work on desensitizing our feet so that when we go to move them through some toe cars like we did in the assessment, we're going to be able to get a little bit more movement hopefully and kind of make our feet more aware of where they are. A lot of the times we have a total disconnect due to the footwear we use or just lack of attention to them really. They're so far down there we often forget how to move our feet specifically. So after that, then we're going to go into something more specific with the big toe, doing some passive range holds, which we'll get into near the end of the video. In terms of massaging your feet, there's not necessarily a right or a wrong way to do it, but I kind of have a couple places I like to start from, and then from there we're really trying to find what's called a hot spot. So somewhere that's a little bit more tender, that might incite some pain or discomfort. Always, adjust pressure. Obviously, if you step into the ball a little bit more, put some more pressure on, that's going to get more intense. If you back off that leg and go more onto your balanced leg, it's going to be less intense. So work within your pain tolerance, and you don't need to kind of grind your foot into a pulp. That won't be necessary today. So we're going to start at, it's called the metatarsal phalangeal joint, which is a fancy way of saying these nubs underneath. Okay, so I like to start from the big toe. You're going to go just below that joint, so not on the bony surface. That's not going to feel that great. We're going to go just below to where there's some soft tissue, and then we're just going to plant our heel and rotate the foot side to side. This is roughly where we're going to strike the ground when we're running, so it sometimes get a little bit uncomfortable. So I like to start there. It's also going to mobilize some of the toe joints, and like I said, get them prepared for the toe cars later on. Now, you can also come along what's called the medial arch. So that's going to be the arch on the inside of your foot. You're going to start from the heel, kind of where it would start to come up. And then we're just going to slowly roll along the inside until we hit that bony joint, and then we'll go back towards the heel. In terms of total time, I recommend spending anywhere between 2 to 5 minutes on each foot, especially if you've done or going to do any hiking or anything like that in the day. The last one, we're going to move more central, so we're going to start right from the heel. Again, you can start right on the bone, just don't put a lot of pressure, and then as you get into the soft tissue along the bottom of the foot, you can start to press a little bit harder and roll there. Now remember what I was saying about hot spots is while you're doing these, all you're paying attention for is where am I a little bit more tender, or if you can feel any kind of tougher spots in the foot where there's more resistance into the ball. You want to spend a little bit more time there, so you might just sink into that hot spot, and as you can, start to put a little bit more pressure until it starts to get less intense. You can increase the pressure a little bit more again by just leaning onto that front leg, and then you'll go through. So we'll go over to the other side. Again, we're going to start, there's that bony joint, we're going to go just below it, plant the heel, and then rotate our foot side to side. And then once you've gone back and forth there, we've mobilized the toe joints. We're going to go to the inside of the foot, starting nice and slow, just rolling back and forth, paying attention for any hot spots. For me right now, this spot is particularly nasty. So I'm just going to ease up on the pressure at first, allow it to kind of sink in and relax around the ball. Sometimes I like to imagine kind of my foot absorbing the ball instead of being hard and rigid on it, right? Then it's resistance against resistance. You want to try to let your foot melt into that ball and kind of absorb it into the foot. And then after hanging out from there, I might just go back and forth on that area. Again, this is just my spot. You're going to find your own spot and kind of just work into there. Maybe you might go circular, right? Just find a pattern that tends to decrease the amount of sensitivity on that area. And then we can go more central to the heel and slide forward and back there. right there again. So find your pattern that works. Maybe you go side to side, maybe you go forward and back. Maybe you just hang out and go still on that area. Like I said, there's no right or wrong way to do this. You're just looking for those hot spots. You're gonna work out some of that tissue, but as well as desensitize them. So now, when we go into the movement phase, they're a bit more ready to be moved. So next up, we're gonna go through some toe cars. So like we did in the assessment, first thing we're gonna do is work on an active splay. So big toe plants into the ground, other toes try to get as far away as possible, and then we try to make contact with all of our toes. Don't worry if it doesn't look like this quite yet. The goal is just to try to put space between each one of your toes. If you notice that some aren't able to create space, just take note of it, right? Over time, we look at gaining more control and being able to put that space in there. Next up, we're going to go for some movement. So we're going to plant all of our toes, actively push them into the ground. And then from there, we're going to just try to lift the big toes up and hold for 5, 4, 3, 2, 1, and slowly put them back down. We're going to do 2 more reps just like that. So lift the big toes up, 5, 4, 3, 2, 1. Bring them back down. Last one, just the big toes, rest them pushing down for another 3, 2, 1, and relax. Now we're going to do the reverse. Big toes press into the ground, other 4 toes lift up. Try to keep that splay as best you can for 3, 2, 1, and relax. We're going 2 more reps. So a total of 3 5-second holds. 5, 4, 3, 2, 1, and relax. One more. Lift them up. Keep that big toe pressing down for 3, 2, 1, and relax the foot. This is where things are going to get a little fun. We're going to try to lift all the toes up now and do the reverse. So now we're just trying to put our big toes down for 5, 4, 3, 2, 1. Good. And again, just the big toe. 5, 4, 3, 2, 1. One more. Just the big toe going down for 5, 4, 3, 2, 1. All right, now it's the other 4 toes turn. We press those down. Big toes stay up. 5, 4, 3, 2, 1. Lift them back up. Just the 4 toes going down. 5, 4, 3, 2, 1. Good. And one more. 5, 4, 3, 2, 1. And they can all relax. All right, the last thing we're going to go over is going to be a big toe passive range hold. As we get into position for the big toe passive range holds, one thing to watch out for is where your shin placement is. So as we go further into what's called dorsiflexion, where we see this angle start to close, it is going to be harder and eventually impossible to get your big toe up off the ground. So you want to try to find a position, if you're seated, will work best, where you see this angle is open and you can get a lot more movement out of the big toe. Because what our goal is in this is a passive range is going to be how far can I lift my big toe up with my hand. Our active range is how much of that range can I hold. So you can see as I let go of the toe, there's a bit of that drop, and that's pretty normal, but our goal in a passive range hold is to close that gap as much as we can. So we'll get started. So if you grab onto your big toe, peel it back as high as you can, try to keep your other 4 toes on the ground, and you're just going to slowly start to pull that toe towards the top of your foot and take control as you reduce pressure in your fingers, and eventually letting go for 5, 4, 3, 2, 1, and relax. We'll pull it back as far as we can. Other 4 toes on the ground, we slowly start to take over. 5, 4, 3, 2, 1. Good. We'll do one more here. Pulling it all the way back. Try to hold that position. 5, 4, 3, 2, 1, and slowly let it back down. And then we'll do the same thing on the other side. So we're going to peel that big toe up and off the ground. Other 4 toes stay on the ground. Then we're going to slowly take control of that toe. Hold. 5, 4, 3, 2, 1. Slowly take back control. Hold. Start to take over. 5, 4, 3, 2, 1. Slowly pull it back up. Do not let it move. Try to hold everything in position. Other 4 toes on the ground. We slowly let go. Keep fighting to keep that up as high as you can. You keep pulling it towards the top of your foot. 2, 1. And we can let that slowly relax onto the ground. So like I said, our goal with that exercise is to try and make this, our passive range, look exactly like that, our active range. And if there's a bit of a lag, it's somewhere to work on. If there's a lot of lag, you should be doing this almost once a day. And this could take you anywhere between 30 seconds to a minute. And you really start to see some benefits in your walking, running. If you have any foot or ankle or even knee pain, they are heavily linked to the big toe. It is called the great toe for a reason. I hope you enjoyed some foot care today. Have a good one.